Super. Great. Thank you very much, and thanks everybody for making this technology. So just as a background, TechWorks projects are always structured as relays. So where we start with one individual or a group and they get to the end of their time and talent, and then we hand the baton and someone takes that off. So how this Jubie's project came about and her contribution today starts from the COVID pandemic, when it was TechWorks' plan to track Central New York advances to help fight the COVID virus. So for our archives, for possible displays, for possible programs in the future, we thought it was important to capture things as they were happening. And to that end, in the spring of 2021, a senior emailed and said, I've got some extra time, what can I do? And so she started on it. She had worked that summer in an Episcopal company making COVID test kits, and so she was really ideal. And then at the end of the spring, when she graduated in May, she handed us her capture. And Jubie called in the summer. She had moved from Long Island to Atlanta and didn't have enough to do. So she started working on this and collecting data. And when she came back to campus in the fall, she signed up for an independent study for credit in the history department with Professor Jubie Tan and us. So what's really remarkable about both Catherine and Jubie, and I think perhaps the university, is they put big focus on for getting freshmen into the research strategy, working on projects, getting, not everybody, but the selected ones get to work with faculty members and do this. So Jubie was an education research scholar helping with a project funded by NSF on pandemic learning environments and the impacts of those. She's also worked as a mentor for the Emerging Leader Program as a sophomore. She works for the NSF Innovation Corps, which we heard Eric Krohn talk about a few weeks ago, and particularly diversity, women, STEM careers, with the School of Management doing some data analysis on how effective virtual teams are after COVID. So she's really got a broad sector. Now, as of January, she decided to focus on her major, which is psychology. So we're delighted to have her come tell us today about what she was able to accomplish in the last 6 months or so, not 8 months, and we're delighted. So thank you, Jubie, and it's all yours.
Thank you, Susan, for the delightful introduction. Before we get started, I do want to thank Susan and Dr. Fatih Fan for guiding me through this project. Without their encouragement and consistent support, I don't think I would be able to complete this. And I do also want to thank Dr. Chafee for overseeing my presentation, coordinating everything, and giving me really helpful advice. So without further ado, let's get started. So I studied COVID-19 medical innovations in Central New York and the Southern Tier, but why did I choose this topic? So creativity as a quality, a trait, a skill is very important throughout all of human history. We need it for business, art, technology, but also something as small as chores, something as small as day-to-day interactions with other people. But we were particularly interested in how such a quality manifested during the pandemic and continues to manifest after. And we did focus on the regions of Central New York and the Southern Tier and a little bit of the Finger Lakes region, because that is what TechWorks is all about, preserving and celebrating the local technology. And these are our two research questions. So number one, what solutions were developed and used in Central New York and the Southern Tier to respond to medical problems related to the COVID-19 pandemic? And number two, what sorts of problems did these tools attempt to tackle? What was the impact of these tools? So this is very important because from the patterns that we can observe from the innovations, maybe we can apply these different strategies and motivations to other problems in the future, maybe another pandemic or another global crisis in any respect. So we just want to see how local regions responded to a global issue on a smaller scale. So The layout of this presentation will be after the introduction, I will go over the methods, the results, and then the conclusion. And then after that, I invite you all to ask me any questions. I am so happy to see what you guys think. So these are the 10 regional councils of New York, and this is mainly for me because I'm not from around here, so it was a struggle to get to know my exclusion and inclusion criteria. We did include this part of the Finger Lakes just because there is a little bit of research done here. So moving on. These were my methods. It's a very rough sketch. There's more subcomponents, but this is the timeline. I started this project, like Susan said, in June. I contacted her, but the bulk of the research project actually happened last fall. So that was late August to just early December. That comprised step 2 and step 3, but a little bit of step 1 as well. So number 1. The preliminary search. I went on Press Connects because I did hear that it was a local news network. I also discovered Spectrum News. I just wanted to see what was out there, whether or not these news networks could link me to other sites, journal articles maybe, or links to startups that were working on breakthrough technologies. But unfortunately, I was not able to find these. I also consulted the Broome County official website, or broomcounty.com, but I was also not successful there either. All I found was how to get a COVID-19 vaccine, how to schedule an appointment, combat different symptoms. So it was not really relevant to our research questions. So then I met up with Susan and we refined our scope and techniques. We focused on research institutions in this area. So that was Binghamton University, Cornell University, and Syracuse University. We also checked other colleges around too, such as Ithaca, but we weren't able to find as many. And these 3 institutions are notable because they are R1 institutions, which means that they have high research activity, very high in fact. And we also shifted our focus to product level innovations in healthcare because initially I was finding a lot of innovations in business and education that were less clearly defined. So even though those innovations are very important as well, that would be too large of a scope. So we started with these university websites, and through their Office of Entrepreneurship and Partnerships, we were able to then go back to startups, and they usually publicize themselves with different press releases. So then we actually ended up back to the local news networks, which led me to believe that maybe the search engines weren't powerful enough, or I needed more domain knowledge to be able to target different terms. That's why the search engines on the local news network didn't really work out for me in the beginning. So then we have our data collection and analysis process. I gathered different journal articles, instruction manuals, videos on YouTube, Vimeo, and local news articles. And I categorized each technology based on different frameworks that university websites were using, most notably the Northwestern one for COVID-19 solution. So they had diagnostics, and then I made that into testing because I also had to adapt those categories to my own findings. So this was a really rough spreadsheet because, as you can see, I put new design for offices as under P, which I'll show later. It means prevention of interaction, but this would not be fitting for our research question just because it's not like a product level solution. It's just a design, it's just a technique, and not really something like a vacuum helmet. So this is the final table for all the results, and as you can see, there's this key, as is for sanitization, and it's very interesting because when you put it on this bar graph, you can see the diversity of innovations. So if we see Binghamton, there are no T innovations. VAXxed for testing. And I was looking at this company called LabCorp, which is responsible for a lot of the diagnostics in Syracuse and Ithaca, but they had no locations in Binghamton. So that is worthy of investigation. I didn't go in that direction, but that would definitely be an interesting route. And looking at Syracuse, we don't see any R innovations for treatment. So that might be interesting to look into as well. But look at Ithaca, they have all of them except for D distribution, which only Corning has because of their very important Valor vials. So just to compare these two bar graphs, it kind of lines up. These are the research funding that's available for all these institutions. So this is in millions. Cornell has 1.19 billion, so they are overpowering the others. But it's interesting that if we look at the innovations, they're not too far off. I mean, I probably didn't go through all of the innovations, but I did look at a lot of the official websites and collected all of the journal articles. So even if I missed some, I don't expect that I missed too many because of all the websites that I went through. So I just thought that this difference was interesting, even though it lined up. The actual number of innovations was not that big. So here are all of the different technologies that I was able to look into, and I bolded the ones that I thought were the most interesting. But of course, in this presentation, we're only going to be focusing on 3, the most important ones, with the most journal articles and the greatest impact on the local area. So yeah, here we have the Rheonics workstation, the nasal spray. If any of you are interested in learning more about each of these technologies, feel free to reach out and I can send you resources. So number 1, we have Rheonics. It's situated in Ithaca and it's under the testing umbrella. And as you can see, it partners with the Cayuga health system to test people in massive numbers. So at the end, it was actually able to test millions of people, which is very impressive. And here we have the CEO and founder of Rheonics, Greg Galvin. And it's very interesting because you can see that he has a master's and a PhD in addition to an MBA. So not only does he have this academic research background, but he is also able to market that and turn it into a reality that benefits society at large. And it's probably because he does have this connection with Cornell University that they are able to partner up and have a greater impact, as great as it does right now. So this is in vitro diagnostics. You load the samples in a cartridge and then you test it. And Rheonics is known for how efficient it is. It provides same-day results. It's very precise. And it's easy to use. It's easy to train people to use this, and it has a relatively low price compared to its competitors. And they have a very big impact too. They partner with the city of Binghamton, the United Health Services, and as we said before, Cayuga Medical Center. And now they're trying to spread this technology across upstate New York, as well as Pennsylvania, Vermont, and Florida. And next up, we have Quadrant Biosciences. Located in Syracuse, they actually overlap. So some of their technologies are under the testing umbrella, and they have another one that belongs in sanitization. But the most remarkable technology that they have developed is the Clarify COVID-19 saliva test, because it has the lowest limit of detection, which basically means that it's the most sensitive. And that is amazing because if you see FDA.gov, they are listed as the most sensitive. And I think it's so cool that Syracuse is very nearby and we have access to these brilliant innovators. So this is the inventor of the Clarify COVID-19 test kit. It's a saliva swab. So the saliva is a sample, and that's great because saliva is non-invasive and it's easy to obtain. And he also has a PhD from Upstate Medical University, which is also located in Syracuse. So maybe that was the connection. So they have the saliva swab for individual testing as well as group testing, and that's affordable, precise, non-invasive, as we said, and easily administered. It's very user-friendly, but also we have wastewater surveillance. So basically they take samples of the water, so they're not going to each individual person and testing it. They're collecting samples of the wastewater and they're analyzing it to see if there's the presence of COVID-19. But other than COVID-19, they can also see drug usage in the area. And this is also very precise, efficient, and the good thing about water surveillance is that it's predictive, it's preventative. So you can track potential hotspots for transmission, and when you communicate it to the government, then they can respond to it early on and hopefully help people stay safe. So Quadrant Biosciences also has a huge impact in schools, universities. It's partnering with Upstate Medical University, SUNY ESF, and Arcadis, which is an engineering company, to implement the water surveillance systems in different campuses so they can monitor their students very efficiently. And they also have an app to guide patients through the onboarding process, which is great because this demonstrates that they do care about the patient's experience of the process. So not only do they want the patients to be safe, they want the patients to be well informed of what sorts of treatments they're receiving or what sorts of testing they have. So lastly, we have Corning. Corning is also very amazing, situating in Corning. So their technology belongs to the distribution category. And here we have a comparison of the conventional vial versus their special vial made of Valor glass. So Valor glass is known for being very durable. If you throw it in a bin, it won't crack and scratch, unlike the traditional vials. And they've been developing this for such a long time, since the SARS pandemic. So the SARS epidemic, rather. So it's very interesting that now we're able to apply a previous technology to a current problem and hopefully any problems that may arise in the future. So if you can see this graph, it's actually pretty drastic, right? The conventional vial is able to withstand 20 kilograms of force. And in my head, that seems like a lot already, but the Valor glass vial can withstand 454 kilograms of force. That's a huge difference. And not only can it survive lots of impacts, it is also able to stay still and ensure a streamlined manufacturing process because they have this protective coating that prevents friction. So that reduces the settled glass particulate, which can contaminate the vial, but also it prevents these hindrances in the flow of the manufacturing process. So that also helps people get their vials quicker. And Corning has a large impact, not only in the United States, but around the world. It has manufacturing stations in China, France, Mexico, and Poland, but also all of these different states in the United States. And they are the global supplier of glass and other glass-related materials. So, what do we make of all of these results? Number one, innovations do tend to be clustered in high areas with within areas with high research activity. So with Corning, they are not located near a research institution, but Corning themselves prioritize manufacturing research, which is most likely the reason why they're able to dominate the glass industry and provide such helpful and innovative materials to the rest of the world. And also, number two, we have impactful innovations that are customer centric. So they do care about how their target population is benefiting from them. What do our customers need? How can we better help them? And not just, oh, here's a problem, let's solve it. So they do have people in mind. And number two, we have the number three, the role of novelty. Many test kits and trackers were developed. We see a lot of patterns. A lot of people are trying to make the same things. A lot of people are making diagnostics and not stuff like the vacuum helmet. So even though this is a very effective method for protecting doctors and dentists from infections, but it's not the most practical and not the most marketable, at least as it stands right now. So as you can see, it's very interesting. There's a filtration pump. It traps the droplets and it redirects the airflow to prevent contamination of the environment, but it also protects the user of the helmet. But yeah, we don't really see a lot of these helmets. So even though they're very cool to read about and study, maybe there's a reason why people are working on the same things, a lot of them at least. So that is the end of my presentation. If you have any questions, I welcome it. Thank you all for listening and joining me today.
Thank you, Jubie. Can you hear us? Yes, thank you very much. That was fascinating. And I think both Professor Chafee and Professor Fan will be very pleased. So thank you for doing this. Any questions? And let's open the floor to questions, comments.
Very nice to be reminded of the things that have gone on in the last 2 years and the talent that we have in the southern tier and Finger Lakes.
Yeah, I agree.
I have heard that the deer population has a very large percentage of COVID.
Sorry, I can't really hear the question.
I'll try, yeah.
Okay, Susan is saying that people are talking about that the deer population, the white-tailed deer that sort of hop across the road, that they have a high percentage of COVID infection. So then
the question is, does that have an effect? Have you heard about it? Have you studied it at all? And does that have an effect on us as humans through eating the meat or just being around them and leaving their refuse behind?
So the second part of that is is there any evidence that you've seen about that infection, COVID infection from deer being transferred to humans through eating the meat, being nearby their, leaving their refuse, that sort of thing? Is that something that has come across your radar screen, the COVID infection in deer population?
I have not studied the deer population. I was mainly focused on how humans have created the technologies, but that's a very interesting question. I'm sure that there are tons of articles out there. Many animals are vectors of disease, so it's very possible. I don't know much about this topic, but that is very interesting.
No one wants to ask. I want to ask about that mask that you showed at the end. Where is that made? Does that come from Syracuse, or did I understand correctly?
That was from Cornell University, actually.
Okay.
But is that mask the only thing, or is there other equipment attached to it? It looked like there was something coming out of the guy's head on the top of it, So are there filtration units?
So it's actually not a mask. It's called a vacuum helmet because it manipulates the airflow. And that thing at the top, I believe that's the filtration pump. So I can pull up the picture again. So yeah, I think this is the filtration pump. So this is where the air comes in, and it's still under development, which is why we don't see any applications of it that many. But yeah, it's very interesting. If you want, I can send you the journal article on it.
I would like to ask about the saliva testing. Is that now being used and where?
That is being, oh, sorry, what?
Well, is that still in research, or is that actually being used?
So it's right. So I have had questions where it's like, oh, if it's being used in all these different regions, why don't I see it around? And I relate to that. I actually have not ever done a saliva swab. It's always been the nose one. But according to all of these news networks, they are being used in Binghamton too, but also in Ithaca, Syracuse, all of these regions. I'm not sure where they are, like maybe it's specific hospitals, specific medical centers, but they are being used pretty rampantly.
Yeah, it is. That's another thing we can try to convince someone to follow up on. Yeah.
I have to say, I had a saliva test at Lord's, and this was back near the beginning of the pandemic, and I was getting, I think it was when I was getting surgery done, and they had to test me, and so I went in and they did a in your mouth test. So I think that they've been around quite a while now.
Oh, so that's we could ask Lourdes then for that too. Okay.
Well, I saw some pictures from the Olympics with athletes waiting to be tested, and they were getting what looked like a saliva test. I mean, they had their mouths open, not their noses open.
Jubie, can you hear what you said?
Something about the Olympics?
Yeah. Right.
Yeah, it looked like they were doing saliva testing at the Olympics.
Could you explain a little bit about how the wastewater surveillance works at a campus so that they test the dormitory? Is that how that works? That the
Yeah, so
then
they just take samples of the wastewater that is from the dormitories to see if there is a presence of COVID-19, if those samples test positive, but also they could check drug usage, so how concentrated it is. So it's samples of the wastewater from these dorms, but also across campus too. So not only the dorms, other areas for wastewater. Oh.
So what happens to the information that they collect from the wastewater? Does anything change because of that?
The question is, what happens to the data collected from the wastewater?
Right, so this is a very good question. We use this wastewater data and we communicate it to local officials so they can see if we need to shut anything down, if we need to monitor the situation. So it's helping local officials as well as different university administrators determine the best course of action in the future. So in that way, it's very helpful because it's predictive.
I would imagine that would allow them, the university, to do targeted testing. So if they test positive in a particular dorm, they can go in and test all of the residents of that dorm. That might be a way to develop a testing sample plan. Jubie, if you were not going to divert yourself back to your major of psychology this semester, what would you recommend would be the path for future to continue this kind of data collection and research? Where would you suggest that we keep going?
I think there are new articles coming out, so I would continue checking those patent websites on these research institutions. But where else would I see? I would continue looking at some of the other technologies that I have collected, just because when I found them, they were still in a stage of development, so they weren't able to market themselves. I would also check check technology transfer offices too, because they're all about how to transform research into a market reality.
Thank you.
Any other questions?
I'm just asking. Any other questions? Any other questions? So if we have a few minutes left, could you talk to us briefly about the study you did? I believe it was with the School of Education. You worked on a project looking at students' interest in hybrid classes or in-person or remote learning.
So that's actually not the same one. So right now I'm working on a grant with Professor Amber Simpson. That is a separate project from the COVID learning one that I did for their source project. So the source project is an honors social science first year research immersion program at Binghamton University. And I was placed under the social context and learning stream. And for that project, I collaborated with 2 other undergrad researchers to study how undergraduates perceive creative attributes in the learning environment. So not whether or not the students were actually creative, whether they thought the environment was conducive to creativity. So whether hybrid or remote environments had enough support, had enough engagement, stuff like that. And we adapted this from this peer-reviewed questionnaire called Keys Assessing the Climate for Creativity. So that was originally developed for the work environment, but we were able to abridge it and change certain things to make it fit the learning environment. And what we found was that, oh, what? Susan, did you say something? Okay.
Yeah,
Okay. What we found was that students were kind of ambivalent. So it wasn't just, oh, we hate remote learning or we love it. It was very mixed, which is something that was unexpected for us. We thought that students would not be as engaged online, but it turns out that a significant portion of them actually preferred remote learning because of its convenience and lack of pressure in some cases. So that was very illuminating. But this might not apply to other students, particularly the younger students who do need more of that physical interaction, in-person bonding. But yeah, personally, I feel that there are definitely very strong pros and cons for both in-person and remote learning.
I'm curious about the possible applications of the helmet, which is rather fast because it looks extremely effective. I don't see our entire choir wearing them to sing, although it'd probably be protective. But I'm curious, is this just like a more laboratory situation or isolated hospital situation? It's obviously not going to be the person on the street. But it looks very promising. Where do you see that being applied, even independent of the cost of it?
I see it being applied to medical professionals, people who need to be constantly in this environment where they're exposed to different antigens. So this is especially true for dentists because they need to interact with a lot of exposed mouth. So they do get infected a lot. So I believe that the vacuum helmet was initially designed for dentists and other family doctors and people who do interact with patients all the time. So yeah, that would be very applicable, I would say, but not for me, not for a student. Yeah. Thank you for asking though. Any more questions?
I've got a technical question concerning that helmet. The helmet appeared to have an opening in front of the mouth of the person wearing it, and it showed the airflow going in through that opening and out at the top. So presumably at the top there's something resembling a vacuum cleaner. Clinical, of course, not your regular household type. That made me think that that helmet might in fact work on a patient, prevent the patient's airflow and air spray from exiting into the room, rather than a professional wearing it. With the airflow on that picture, it appeared to me that it sucks in air from the room. So if the professional wears it and there is contaminated air in the room, the professional would get a bit of that into the helmet. Yes, some of it gets sucked out, but the professional would also be using whatever comes in for their own air and oxygen supply. So could you be able to expand on whether that helmet is intended for patients as an inexpensive way to substitute a low pressure room, low air pressure room for a infectious patient, or whether it's intended for professionals?
So according to the articles that I have read introducing this technology, they have always framed it as, oh, this is for dentists and other doctors. But that is a very good point about the patients, because it is to not only protect the user, but also prevent further contamination of the air. So, you know, I think it might be possible in the future, if this continues to develop, that patients will be able to access it and wear it if they want to. But as of right now, I don't see any articles talking about how this can be applied to patients, but it's definitely possible.
If you think about going to the dentist, being required to wear one of those is no more offensive than the other things that the dentists do to you. If you think
Yeah.
dentists tend to do a lot of crazy things, so this could work.
You'd need a bigger mouth hole though for them to get in.
It's part of the research.
No, you just have the dentist wear it. I mean,
I saw an article this morning out of the Atlantic that said COVID won't end up like the flu. It will be like smoking. So I wondered if Jubie had any, it's in the Atlantic saying that the people who are always minimizing COVID are saying that it's going to be as, it's going to become an endemic, no longer a pandemic. And so anyway, it's the Atlantic, so it's something we should be paying attention to, I guess. Anyway, the COVID won't end up like smoking. I haven't read the article as yet, but one of those things I plan to do today. Interesting, right? I mean, I live in a building close to the Presbyterian Hospital. So I asked the medical researcher when we're going to go back to normal. And he said, well, it's going to become like the flu. So this is just a common trope with people, that it's going to become like the flu. What do you think, Jubie? Is it time to just be more relaxed about COVID and say that the number of people who die will be less and we'll have new shots every year, just like our flu shots?
I think it's hard to say just because I'm not a medical professional. So I think in this way, I'm in the same position as all of you. From what I have read personally, I would just say, I think everyone has their own standards when it comes to staying safe. So personally, I would just do my best and stay safe to protect the people around me. But, it's very hard, especially for a lot of people to go through it, and especially if they have other complications, that makes it difficult to do a lot of precautions. Yeah, because people have different standards. Like some people are still unwilling to sit down in a restaurant, even for a short amount of time. Some people are still unwilling to enter another building unmasked. But you know, other people are doing a lot of things, and it's very hard to tell. But that is a good question, and this is a great article. I haven't read it, but I would be interested to.
There's an article in the Washington Post, I think it was yesterday, not very early this morning, that talks about, it's by a medical, a doctor, and he does the math, if you will, of the risk analysis for him to go to a party with 50 people, and then and what that make sense. So could he go with the mask? Could he go without a mask? Of that, and it was something. And he, like the article that you saw, Adrian, he suggests this is a long-term risk analysis decision-making process that's going to be happening. But if I can find the link, I'll send it to Peter, and we can and you. So,
Well, I read an article. Well, I didn't read the article. I saw the byline, so I may go back to read the article. But they were debating whether or not, and I think the debate was on whether we should have a fourth vaccine, you know, coming up on for COVID in the fall. And I think, like I said, I didn't read the article, but it seemed like the consensus was, yes, we should. So it may turn out to be more an endemic than an endemic.
Jubie, I just tell us really, I think we're about ready to wrap up, but Jubie's been invited to present her research. I believe you can explain a little about it to a professional organization in Baltimore next month. Just a real quick overview of that, and then I think we'll let you go and we'll all go to lunch. How does that sound? Okay.
Yeah, so it was actually the same research project as the source project one that I talked about. It was just COVID-19 learning during, with like students and perceiving creativity. That was the same project. So I will just be presenting a poster of that at Northeast Modern Language Association this March. Over spring break. So that's very exciting for me because that's my first non-Binghamton University related conference. Well, it is related to the university, but it's not part of the university's programming. So that is very exciting for me. But thank you all for listening and asking questions. I'm so happy and grateful to be meeting you all today. I wish you all the best in everything.
Thank you very much. Good luck. Good luck.
Thank you.